On today's show, we're discussing a new scientific statement from the American Heart Association on the importance of physical activity in obesity care. I'm Jennifer Abbasi, director of JAMA Medical News. Staff writer Samantha Anderer is here to tell us about the news. Sammy, thanks for joining.
Thanks, Jen.
So what can you tell us about the AHA statement?
Yeah, so it really reinforces the role of physical activity in obesity care, particularly in the context of new pharmacotherapies. Over the past few years, GLP-1 medications like semaglutide and tirzepatide have helped many patients achieve significant weight loss and improve cardiometabolic outcomes. But the medications, as well as bariatric surgery, are meant to be used in combination with physical activity. Dr. Francois Marvel, an author of this statement and an assistant professor of medicine in the Division of Cardiology at Johns Hopkins University School of Medicine, told me that the goal of the AHA scientific statement is really to reframe how physical activity is more than just a weight loss tool. It's a cardiometabolic therapy.
So what are some of the benefits of physical activity beyond weight loss that are highlighted in the statement?
The statement emphasizes that physical activity reduces high blood pressure, improves cholesterol profiles, and boosts insulin sensitivity, all of which are common goals for people with obesity. Exercise also helps improve muscle quality. This is important considering that when people lose weight using GLP-1 drugs, they may lose some skeletal muscle, which helps with healthy aging and blood glucose regulation. And muscle quality may already be compromised in individuals with obesity due to fat infiltration.
So the timing of this statement makes sense. In your story, you cited new data that demonstrates that patients using GLP-1 therapies on average decrease their physical activity, whereas the hope is that losing weight will help people move more. That research was based on objective wearable device data. Now, the AHA statement offers advice for how clinicians can help patients with obesity become more physically active. What are some of the suggestions?
Well, the physical activity guidelines for Americans recommend that adults engage in at least 150 minutes of moderate intensity or 75 minutes of vigorous aerobic physical activity a week, in addition to muscle strengthening activities 2 times a week. But AHA notes that people who are just starting out may still achieve measurable health benefits with more modest amounts of exercise. The statement suggests that clinicians use the 5A behavioral model with their patients: assess, advise, agree, assist, and arrange. Essentially, this means starting out by gauging a patient's current activity level and readiness to engage, and then providing advice on how to exercise, setting goals together, addressing obstacles, and following up on progress. AHA recommends clinicians follow the SMART framework, making objectives specific, measurable, achievable, relevant, and time-bound. Devices such as pedometers, mobile health apps, and smartwatches may help patients keep track of their progress and share it with clinicians.
When talking with experts for this story, did you discuss any specific barriers to these exercise goals or strategies to overcome them?
Yeah, that was a big part of my conversations. Even if patients know that exercise is an important part of obesity care, it may be difficult to implement due to lack of time, resources, or safe spaces. The statement emphasizes the importance of the physician's role in problem-solving around these hurdles. Creative solutions from Dr. Marvel range from recommending a few trips up a flight of stairs at home to sharing information about discounted YMCA memberships for older adults. Another expert I spoke with said that instead of thinking about behavior change and behavior modification, he thinks about behavior integration into one's lifestyle. So parking the car farther away from the destination to get some more steps in, for example. The bottom line was that some activity is better than none, and that exercise is a key component of comprehensive obesity care.
Thanks, Sammy. All right, if you'd like to learn more, we'll include a link to Sammy's story in the show description. This week, we also have an interview I did on clinical research highlights from the American Diabetes Association's annual scientific sessions. You can find that episode in this show's feed and all of our stories at jamamedicalnews.com. Thanks to Samantha Anderer for joining me. I'm Jennifer Abbasi for JAMA Medical News. This episode was produced by Daniel Morrow at the JAMA Network. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. Thanks for listening, and join us again next week.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.